വർക്കല ജില്ലാ ഹോസ്പിറ്റലിന്റെ പേരിലും AMAI ആറ്റിങ്ങൽ ഏരിയ കമ്മിറ്റിയുടെ പേരിലും വെബിനാറിലേക്ക് സ്വാഗതം ചെയ്യുകയാണ്. ഒഫീഷ്യലായിട്ട് നമ്മുടെ റെപ്രസെൻറ്റേറ്റീവ് ഉണ്ട്, ഡോക്ടർ ഭാഗ്യ. ഭാഗ്യ ഒന്ന് ഇൻട്രൊഡ്യൂസ് ചെയ്യും. ഭാഗ്യ.
Hello. Okay, ma'am. Welcome, sir. Welcome, everyone. Thank you for joining today's webinar. Your active participation is important throughout the session. I am Bhagya, a representative from Government District Ayurveda Hospital, Varkala. Today, we are presenting on the topic Manasarogas in general practice by Dr. Professor G. Nagabhushanam. Before get started, if you have any questions during the presentation, kindly mention them in the question box, and all delegates are requested to fill the form for recertificate, and the link will be shared as soon as possible. Now, without further ado, I would like to introduce before you our eminent guest, Professor Dr. G. Nagabhushanam, sir, currently serving as the principal of Shantigiri Ayurveda Medical College, Palakkad. He has completed his BMS degree from Dr. BRKR Ayurveda College, AP, and post-graduation in Manovigyan Evam Manasaroga from BPSB Ayurveda College, Kottakkal. He is the chief editor of monthly newsletter Shantigiri Ayurveda Medical College, Palakkad, and he is one of the resource person for many national and international seminars, CMEs, etc. He works as a clinical counselor, orator, writer, and moreover a social worker. His passion for Ayurveda has showered him with lots of achievement. He has been honored with Jivaka Award, Dabar Ayurveda Award, and Award for excellent performance in first junior course in Sanskrit. Sir, we are well privileged to have you in this webinar, and I once again invite all the delegates to the session. Thank you. Sir, screen കാണാമോ?
കാണുന്നുണ്ട്.
Okay, sir.
തുടങ്ങല്ലേ? വെയിറ്റ് ചെയ്യാനോ? വേണ്ടല്ലോ.
ഇല്ല സർ, സ്റ്റാർട്ട് ചെയ്യാം.
ഓക്കെ. ഓം ഇദം നമഃ ഗുരുഭ്യഃ പൂർവജേഭ്യഃ പൂർവേഭ്യഃ പതികൃഭ്യഃ. Respected organizers, Dr. Ashwati, Dr. Bhagya, and other team members, and my dear students, Sabin, Nitin, etc. Actually, it is a privilege for me, and nowadays we have been in these online classes for last nearly 1 year. Of course, it is a good thing that without any physical discomfort, we are able to connect with each other and share our thoughts, knowledge. It is a good thing, and let us utilize this opportunity. And being in medical practice, Ayurvedic practice, you are also experienced. So I too want to share some of your experiences so that togetherly we can go forward. Today's my topic is Manasaroga in general practice. It is specifically chosen because many of the participants are in general practice. So another important area that we come across in general practice is Manasaroga. So I thought it will be beneficial for you. At the same time, generally, whenever we talk to medical officers, generally they want only the clinical conditions and the corresponding medicines, otherwise treatment protocol. But in our practice, without tattva, without shastra, there is no practice, vyavahara. So to have a good vyavahara, the base of shastra, and for a good base of the shastra, there should be a good tattva also. So some of the basic principles also I will be dealing in this session. Okay. Next slide, please. And in this session, that's why we are going to have a discussion on understanding the concept of Manasaroga and their expressions as different level. Because Manasaroga means these clinically they are expressed at different levels, and depending upon the level of the expression, we have to have a treatment protocol. And what is the scope in general practice with a special reference to this Manasika Roga? What are the cases, what are the clinical conditions that we can deal in general practice? And what are the clinical conditions which are to be referred to the specialist practice? And what are the principles of management in generally? And of course, how we can contribute for well-being of the sufferers. It is the ultimate aim of this medical science itself. That's why our motto should be, if we may not be able to treat the condition, but we should be able to diagnose the condition, and we should be able to refer the cases where it is apt, so that the benefit, the patients, the sufferers can benefit out of it. So as a team, it is our ultimate aim to see that the well-being of the sufferers is fulfilled. So in this session, we will be having the total on these topics. Thank you. Next. As you know very well, that is biological tripart, Sarvamatma Shariram Cha, Trayameta Tridandavat, Lokas Tishtat Samyoga Tatra Sarvam Pratishthitam. This is the basic theory of Ayurveda on which all the treatment principles are dependent. Because among these three factors of this tripart, Sharira and Manas are the abodes of the health and diseases. So whatever we talk, whether it is Arogya, Swastha or Atura, they are pertaining to this mind and body. And we know for Atma, it is beyond the scope of this phenomenal existence. That's why we have to understand where the disease is occurring, where its seeds are there, and where it is expressed. Depending upon that one, treatment has to be made. And causes of health and disease and effect at different depths. That's what I told. Because there are some diseases, the seeds, otherwise they are embedded at the deepest level, at the Sukshma Sharira level. In that case, the treatment protocol and the outcome of our management protocol depends upon the depth of the seeds of these diseases, where they are. So we have to understand that one, so that if it is very peripherally situated, it is easy to treat. But if the clinical conditions are arising out of the deeper level of the mind and body, then the outcome also, it will be difficult for us. We know it very well. Next slides. Next, please. Like in our general practice, we will be coming across clinical conditions like complaining of palpitations, tachycardia, increased sweating, flushes, difficulty in breathing, that is dyspnea, constriction in the chest. നെഞ്ചിലെന്തോ ഒരു വേദന പോലെ പിടുത്തം പോലെ എന്ന് നമുക്ക് പേഷ്യൻസ് പറയാറുണ്ട്. ഡ്രൈ മൗത്ത് ആൻഡ് frequent micturition, തലകറങ്ങിയ പോലെ dizziness will be there, diarrhea, otherwise tremors in the hands and legs, feeling of restlessness, vague apprehensions, what happens tomorrow, how I can do that one, how I can appear for that interview, how I can appear for the examination, what happens tomorrow, how I can reach there, like such apprehensions will be there, and irritable, unable to relax, and difficulty in getting sleep. So it is a cluster of clinical condition. What I here presented is, it is a cluster of symptomatology pertaining to a particular clinical condition. So in modern parlance, we say it is anxiety disorders. It is, as it is vague apprehensions throughout the day and night. Generally, it can be considered as GAD, that is generalized anxiety disorder. So it is a cluster of symptomatology, and in our general practice also we come across such type of cases. And this it is not a something specialty related case. Of course, as I told you, if the seeds, otherwise the origin of this clinical condition is very deep, then the treatment also has to be planned as per that one. But generally in our clinical general practice also we come across such type of cases. Next please. It is again a cluster of symptomatology, that is the patient complains of thoughts of dirt or contamination or doubts of homicide or sexual acts intruding into the conscious mind repeatedly in spite of recognizing them irrational, and resorting to washing, checking, and causing a marked distress. ഇടയ്ക്ക് മലയാളത്തിലും വേണ്ടി വരും അല്ലേ? ഓക്കെ, സോ ബോത്ത് മലയാളം ആൻഡ് ഇംഗ്ലീഷ് രണ്ടും നമുക്ക് ചെയ്യാം അല്ലേ? നമ്മുടെ അടുത്ത് വന്നിട്ട് എന്താ റിപ്പീറ്റഡ് ആയി കൈ കാല് കഴുകലും ഒരു കംപ്ലൈന്റ് ആയിട്ട് വരും. ഇല്ലെങ്കിൽ മനസ്സിൽ ആ തോന്നൽ റിപ്പീറ്റഡ് ആയിട്ട് തോന്നൽ വരും, കൈ ശരിയില്ല, അവിടെ തട്ടിയാൽ പിന്നെ കൈ കഴുകണം, കഴുകിയാൽ മതിയാവില്ല, വീണ്ടും വീണ്ടും കഴുകണം എന്നത്. ഇല്ലെങ്കിൽ മനസ്സിൽ ചിന്തകളാണ്, എത്ര വിചാരിച്ചാലും എത്ര ഇറിലവൻ്റ് ആണ് ആ ചിന്തകൾ, എത്ര വിചാരിച്ചാലും ചിലപ്പോൾ മനസ്സിലത് പോവില്ല. അത് ഒരു ഡിസ്ട്രെസ് ആണ്, കൂട്ടുന്ന രീതിയിലാണ് നമുക്ക് ഉണ്ടാവുന്നത്. അതുപോലെ കേസസ് നമ്മുടെ ജനറൽ പ്രാക്ടീസ് നമുക്ക് കാണുന്നതാണ്. ഇറ്റ് ഈസ് എ ഡിസീസ് കണ്ടീഷൻ, ക്ലിനിക്കൽ കണ്ടീഷൻ റിലേറ്റഡ് ടു OCD. Another clinical setup like next slide please. Like it very common ആണ്, multiple somatic symptoms which are vague, and multiple organ systems are the symptoms are related to multiple organ systems, and there is always a frequent change of consultants, and ഡോക്ടർ എന്ത് പറഞ്ഞാലും, ഇപ്പോൾ അതായത് കൈവേദന, കാലുവേദന, ഇല്ലെങ്കിൽ ബേണിംഗ് സെൻസേഷൻ, അല്ലാന്നുണ്ടെങ്കിൽ തരിപ്പ് എന്ന് പറയും, അതുപോലെ അത്. ബട്ട് നമുക്ക് SLR, ഇപ്പോൾ കാലെന്ന് പറയുമ്പോൾ SLR ടെസ്റ്റോ അങ്ങനെ എന്തെങ്കിലും ചെയ്താൽ അത് ഒരു എന്താ പർട്ടിക്കുലറായ ഏതെങ്കിലും ഒരു നെർവിന്റെ ഇന്നർവേഷൻ റിലേറ്റഡ് ആയിട്ടോ അത് നമുക്കൊന്നും കാണാൻ സാധിക്കില്ല. അതുപോലെ കേസസ് ആണ് നമുക്ക് പൊതുവെ ജനറൽ പ്രാക്ടീസിൽ നമുക്ക് വരാൻ സാധ്യതയുണ്ട്. അത് വെറും വേദന വിചാരിച്ചിട്ട് അതിനുവേണ്ടി മാത്രം ട്രീറ്റ്മെന്റ് ചെയ്യാൻ തുടങ്ങിയ പേഷ്യന്റ് സാറ്റിസ്ഫൈ ആവില്ല, മാത്രമല്ല റിസൾട്ട് കിട്ടുകയില്ല. ബിക്കോസ് ദി കോസ് ഓഫ് സച്ച് ക്ലിനിക്കൽ കണ്ടീഷൻ ഈസ് സംതിങ് ഡിഫറെന്റ്. അതുകൊണ്ട് ഡോക്ടർ അതൊക്കെ നോക്കിയിട്ട് പല എക്സ്റേ അതൊക്കെ എടുത്തിട്ട് ശേഷം, MRI എടുത്തിട്ട് ശേഷം ഒരു ബുദ്ധിമുട്ട് ഇല്ല എന്ന് പറഞ്ഞ പേഷ്യന്റ് നിരാശയോടെയാണ് വേറൊരു ഡോക്ടറുടെ അടുത്ത് പോകുന്നത്. ഇതുപോലെ കേസസ് നമ്മുടെ ജനറൽ പ്രാക്ടീസിൽ കാണാറുണ്ട് അല്ലേ? നെക്സ്റ്റ് സ്ലൈഡ്. ഇറ്റ് ഈസ് എ കേസ്. ഈ ക്ലസ്റ്ററിന് പറയുന്നത് മനസ്സിൽ വേണ്ടതേക്കാൾ കൂടുതൽ ഒരു സന്തോഷം, എലേഷൻ, ഇൻക്രീസ് സൈക്കോമോട്ടർ ആക്ടിവിറ്റി, ഒരു സ്ഥലത്ത് ഇരിക്കാനാവില്ല, എപ്പോൾ എന്തെങ്കിലും ഒന്ന് ചെയ്തുകൊണ്ടേ ഇരിക്കണം. റെസ്റ്റ്ലെസ്നെസ്, സംസാരം ചില സമയത്ത് അത് ഇറിലവൻറ്റ് ആവാൻ സാധ്യതയുണ്ട് സിവിയർ കേസ് ആവുമ്പോൾ. അതേപോലെ ഡിസ്ട്രാക്റ്റീവ്നെസ്, റെഡ്യൂസ്ഡ് സ്ലീപ്പ്, അപ്പറ്റൈറ്റ് ഇൻക്രീസ്ഡ്, അതുപോലെ കേസ് നമുക്ക് കാണാറുണ്ട്. ഇത് ഒരു BPAD എന്ന് പറയുന്നതിൽ മാനിയയുടെ ഒരു കണ്ടീഷനിലാണ് നമുക്ക് സിവിയർ അല്ലാത്ത ഒരു കണ്ടീഷനാണിത്. ഇനീഷ്യൽ സ്റ്റേജിൽ ഒരു യൂഫോറിക്കായ മാനസികാവസ്ഥയിൽ ഉണ്ടാവുന്ന ബൈപോളാർ 2 ഡിസോർഡറിൽ ഒരു കണ്ടീഷനായിട്ട് നമുക്കത് കാണാൻ സാധിക്കും. ഇതുപോലെ ഒരു ക്ലസ്റ്റർ ഓഫ് ക്ലിനിക്കൽ കണ്ടീഷൻസ് സിംപ്റ്റമറ്റോളജി കൊണ്ടും നമ്മുടെ അടുത്ത് ജനറൽ പ്രാക്ടീസിൽ വരാറുണ്ട്. നെക്സ്റ്റ് സ്ലൈഡ്. അതേപോലെ കേസ് complaining of sadness, lack of interest and pleasure, feeling of hopelessness, helplessness, self-guilt, suicidal ideations, reduced energy, feeling of fatigue, increased or decreased sleep, loss of appetite, loss of sexual drive. അല്ലേ? ഇതുപോലെ കേസ് നമ്മുടെ അടുത്ത് വരാനുണ്ട്. ചിലപ്പോൾ ഈ ഒരു ക്ലിനിക്കൽ കംപ്ലയിൻസ് കൊണ്ട് വരുന്ന ആള് ചിലപ്പോൾ വേറൊരു ഡിസീസ് കൂടി അവർ അതിനൊപ്പം ഉണ്ടാവും. ഫോർ എക്സാമ്പിൾ ആരെങ്കിലും ഇപ്പോൾ കാർസിനോമ എന്തെങ്കിലും അങ്ങനെ ഡയഗ്നോസ് ചെയ്തിട്ടുണ്ടെങ്കിൽ അതിനൊപ്പം നമുക്ക് ഇതുപോലെ സിംപ്റ്റമറ്റോളജി നമുക്ക് കാണാറുണ്ട്. നാളേന്ന് പറയുന്നത് എനിക്കില്ല, വർത്ത്ലെസ്നെസ്, ഇനി എന്നെ കൊണ്ട് ആർക്കും ഇനി ഗുണമുണ്ടാവില്ല, ഞാൻ എല്ലാവർക്കും ഒരു ബർഡനാവാൻ പോകുന്നുണ്ട്, അതുകൊണ്ട് ജീവിച്ചിട്ട് കാര്യമില്ല, ഇനി മരിക്കുന്നതാണ് നല്ലത് എന്ന് പറയാറുണ്ട്. ചില കേസ് ചിലപ്പോൾ മരിക്കാൻ വേണ്ടി ശ്രമങ്ങൾ നടത്തിയ കേസസും നമുക്ക് ഉണ്ടാവും. ഓക്കെ, ഇറ്റ് ഈസ് എ സിംപ്റ്റമറ്റോളജി, ക്ലസ്റ്റർ ഓഫ് സിംപ്റ്റമറ്റോളജി റിലേറ്റഡ് ടു ഡിപ്രഷൻ ആണ്. അതേപോലെ ചില കേസസ് ഉണ്ട്, ഒരേ ദിവസം പല മൂഡ് ചേഞ്ചസ് ഉണ്ടാവും. രാവിലെ എണിച്ചാൽ ഒരു മൂഡാണ്, സാഡ് മൂഡ്, അത് കഴിഞ്ഞ് കുറച്ച് നേരം നേരെയാവും, അത് കഴിഞ്ഞിട്ട് വീണ്ടും അതേപോലെ നെക്സ്റ്റ് ആവുമ്പോഴത്തേക്ക് പിന്നെ ശരിയാവും, പിന്നെ വീണ്ടും ഒരു ഡിപ്രസീവ് മൂഡ് വരും. ഇതുപോലെ കേസസ് നമുക്ക് വരാറുണ്ട്, ലൈക്ക് സൈക്ലോതൈമിയ എന്ന് പറയാറുണ്ട്. അതുപോലെ കേസസ് ജനറൽ പ്രാക്ടീസിൽ നമ്മൾ കാണാറുണ്ട്. നെക്സ്റ്റ് സ്ലൈഡ് പ്ലീസ്. അതേപോലെ ഒരു അബ്ഡോമിനൽ പെയിൻ, ആൾട്ടറേഷൻ ഇൻ ബവൽ ഹാബിറ്റ്, സെൻസ് ഓഫ് ഇൻകംപ്ലീറ്റ് എവാക്യുവേഷൻ ആൻഡ് അസോസിയേറ്റഡ് സ്ട്രെസ് ഇൻ ലൈഫ്. ഇത് ഉദ്ദേശിച്ചത് നമ്മുടെ IBS ആണ്. ഇറിറ്റേബിൾ ബവൽ സിൻഡ്രോമിൽ നമ്മുടെ ജനറൽ പ്രാക്ടീസിലും വരാറുണ്ട്. അത് ശരിക്ക് ഹിസ്റ്ററി എക്സാമിനേഷൻ ശരിക്കും നമുക്ക് എടുത്തിട്ടുണ്ടെങ്കിൽ നമുക്ക് അതിൽ ഒരു സ്ട്രെസ്ഫുൾ ഈവൻസ് ലൈഫിൽ ഉണ്ടാവും. അതനുസരിച്ചിട്ടാണ് ഈ സിംറ്റംസ് ഒക്കെ കൂടുന്നതും കുറയുന്നത് നമുക്ക് കാണാൻ സാധിക്കും. ഇതുപോലെ നമുക്ക് കുറെ ക്ലിനിക്കൽ കണ്ടീഷൻസ് ഒക്കെ നമ്മുടെ ജനറൽ പ്രാക്ടീസ് ഇപ്പോൾ പറയുന്നത് പറഞ്ഞ ഈ ക്ലിനിക്കൽ കണ്ടീഷൻസ് ഒക്കെ നമ്മുടെ ജനറൽ പ്രാക്ടീസിൽ നമുക്ക് കാണാൻ സാധിക്കും. അപ്പോ നെക്സ്റ്റ് സ്ലൈഡ് പ്ലീസ്. ഇതുപോലെ മെന്റൽ ഇൽനെസ്, ഇതിനൊപ്പം കോമാർബിഡിറ്റി ഓഫ് അതർ ഡിസോർഡേഴ്സ്. പൊതുവെ many of the mental disorders are associated with otherwise having comorbidity of other physical disorders also. അതുകൊണ്ട് ഒരു ഫിസിക്കൽ കണ്ടീഷൻ കൊണ്ട് നമ്മുടെ അടുത്ത് വരുന്നുണ്ടെങ്കിൽ അതിന്റെ അണ്ടർലൈങ് ഉള്ള ഈ മെന്റൽ ഇൽനെസ് ഡസന്റ് മീൻ ആൾവേസ് ഷിസോഫ്രീനിയ ഇല്ലെങ്കിൽ എന്താ മാനിയ തന്നെ ആവണമെന്നില്ല. അല്ലാതെയും ഒരു അതിന്റെ ഒരു എന്താ ഒരു കോൺട്രിബ്യൂട്ടിംഗ് ഫാക്ടർ ആയിട്ട്, അതായത് ഫിസിക്കൽ ഡിസോർഡേഴ്സിന് കോമാർബിഡിറ്റി ആയിട്ട് മെന്റൽ ഡിസോർഡേഴ്സ് ഉണ്ടാവും, മെന്റൽ ഡിസോർഡേഴ്സിന് കോമാർബിഡിറ്റി ആയിട്ട് ഫിസിക്കൽ ഡിസോർഡേഴ്സും ഉണ്ടാവും. അപ്പോൾ ഒരു ഫിസിക്കൽ ഡിസോർഡർ കൊണ്ട് ജനറൽ പ്രാക്ടീസ് നമ്മുടെ അടുത്ത് വരുന്നുണ്ടെങ്കിൽ അതിന്റെ ഒരു കോമാർബിഡ് മെന്റൽ ഡിസീസ് എന്തെങ്കിലും ഉണ്ടോ എന്നത് നമുക്കൊന്ന് മനസ്സിലാക്കേണ്ട വളരെ അത്യാവശ്യമുണ്ട്. അതേപോലെ സബ്സ്റ്റൻസ് അബ്യൂസ് കേസസ് നമ്മുടെ ജനറൽ പ്രാക്ടീസിൽ വരാറുണ്ട്. അതേപോലെ ലൈക്ക് ടൈപ്പ് 2 ഡയബറ്റീസ് മെല്ലിറ്റസ്, പ്രമേഹത്തിനും പൊതുവെ ഡിപ്രഷൻ അസോസിയേറ്റഡ് എന്നാണ് ഇപ്പോൾ ലേറ്റസ്റ്റ് റീസെർച്ച് ഒക്കെ തെളിയിക്കുന്നത്. മാത്രമല്ല ഡിപ്രഷനും ഈ ടൈപ്പ് 2 ഡയബറ്റീസ് എന്ന് പറയുന്ന അതിന്റെ ഒരു കോമൺ പാത്തോളജി ആണ് പറയുന്നത്. അതുകൊണ്ട് ഒരു ടൈപ്പ് 2 ഡയബറ്റീസ് അതിൽ ഇംപ്രൂവ്മെന്റ് ഉണ്ടാവുന്ന ഏത് മെഷർമെന്റ് ആയാലും ദറ്റ് ഈസ് ഡ്രഗ് കൊണ്ടല്ല, ബാക്കി മെഷർമെന്റ്സ് എന്തൊക്കെയാണ് എടുക്കുന്നത് അതുകൊണ്ട് ഡിപ്രഷൻ ഇംപ്രൂവ് ആവാറുണ്ട്. ഡിപ്രഷനിക്ക് വേണ്ടിയുള്ള മെഷർമെന്റ്സ് നമുക്ക് പേഷ്യന്റ് അടുത്ത് പറഞ്ഞ് ഡയബറ്റിസ് മെല്ലിറ്റസും പ്രമേഹവും അതിൽ ഇംപ്രൂവ്മെന്റ് ഉണ്ടാവാറുണ്ട്. അതേപോലെ ആസിഡ് പെപ്റ്റിക് ഡിസോർഡേഴ്സ് ആർ most of the time they are associated with anxiety disorders. അതുകൊണ്ട് ഇപ്പോൾ ആസിഡിറ്റി കൊണ്ട് വന്നാലും ഇല്ലാന്നുണ്ടെങ്കിൽ ഈവൻ പൈൽസ് ആയാലും ശരി, ഫിസ്റ്റുല ആയാലും ശരി, അതുപോലെ കേസസ് നോക്കിയാലും അതിന്റെ അസോസിയേറ്റഡ് ആയിട്ട് ഈ ആങ്സൈറ്റി ഡിസോർഡേഴ്സ് ദർ ഇസ് എവറി പോസിബിലിറ്റി ഉണ്ടാവാൻ സാധ്യതയുണ്ട്. അപ്പോൾ അതുപോലെ കേസസ് നോക്കുമ്പോൾ ഇതുപോലെ ഒരു മാനസികമായ ഒരു കാരണം അതിന് ഉണ്ടോ, എന്തെങ്കിലും സജഷൻസ് ഉണ്ടോ? ലാംഗ്വേജ് എന്തെങ്കിലും സജഷൻസ് ഉണ്ടോ? എന്തോ ഒരു പെട്ടെന്നൊരു ചാറ്റ് ബോക്സിൽ എന്തോ കണ്ടു. വെദർ യു വാണ്ട് ഇംഗ്ലീഷ് ആർ മലയാളം, രണ്ടും ബുദ്ധിമുട്ടുണ്ടോ? ഈസ് ഇറ്റ് ഫോളോ ചെയ്യാൻ ബുദ്ധിമുട്ടുണ്ടോ? Any of you can respond. Sabin?
പുറത്തുനിന്നുള്ള ആൾക്കാർക്ക് ഉണ്ട്, അപ്പോ കുഴപ്പമില്ല, ഇംഗ്ലീഷ് വേണം എന്നുള്ള അഭിപ്രായമാണ്.
പുറത്തുനിന്ന് ആളുണ്ടല്ലേ?
കേരളത്തിന് പുറത്തുനിന്നുള്ള കർണാടകയിൽ നിന്ന്.
Okay. No problem. Definitely. I'll continue in English. I thought it is, as it is the Varkala area related I am meeting, I thought it is only Malayalis. Definitely, I'll continue in English. Thank you. Yes, in anxiety disorders can be observed in APDs. Acid peptic disorders are many times are associated with anxiety disorders. Okay, next slide, please. And nowadays, these mental illness associated with physical disorders are very much increased, and the various contributing factors are, of course, industrialization, advent of modern science and technology, and the way globalization is occurring, and consumerism, and a modern educational system. In this customs and culture, we are forgetting our own customs and own culture, and we are adapting ourselves to the just copying, not adapting, just we are copying others' customs and cultures, which is making us too much distress in our life. There is increased physical comfort and decreased quality of life, and there is the threshold for stress is very much decreased, and there is no privacy for self-reflection and no time for relaxation also. Particularly when this internet etc., when it is too much developed and we are unable to sit ourselves lonely at one place and reflect on our own systems, our own mental thoughts processes. And particularly due to this COVID-19, due to the work from home and due to the online classes for students and work from home for the employees, the burden has increased a lot. And also another contributing factor for this increased mental illness among the general population is side effects of antipsychotic drugs and their role in other risks like inducing obesity, diabetes, cardiovascular diseases, other metabolic disorders. And even in our general practice, many of the patients will be approaching us due to these antipsychotic drugs, modern psychiatric drugs. There are many side effects, extrapyramidal symptoms, etc., which is that's why compliance for that medical treatment, allopathic medical treatment is very less, and that is a problem. So many of the patients are approaching how I can come out of this allopathic medication. So there also, if in general practice, as a general practitioner, we may not be able to contribute, but definitely we can refer such type of cases. Okay, next slide. In generally, such type of mental illness cases who are approaching in general practice, actually they are able to perform their day-to-day activities compared to the specialty practice, where their day-to-day practice, their day-to-day activities is to perform is not possible, and there is frequent need of consultation that and they will be consulting this general practitioners only. And dependency on others. Generally, in specialty practice, those patients are dependent on others, whereas in general practice, patients are able to perform their day-to-day activities. So there is no dependency on others in general practice. Next slide. And it is the data that is available, which says all over world, general practice is a frontline healthcare unit, and 25% of general practice is of mental health. So this statement is very important. Though it is unobserved, it is not coming our critical thinking and observation, but it is the fact that 25% of general practice is of mental illness, and among this 25%, only 30 to 50% correct diagnosis is done in general practice, and the remaining 50 to 70% without a diagnosis of underlying mental disease, it is a patient is not getting the needed care. And early detection and early intervention can be possible when general practice, the practices in general practice is improved, so that the early detection of the clinical condition can be done, and intervention, early intervention also can be done. So general practice is very having very great role in limiting as well as managing these mental illnesses. Next slide. And the problem is difficulty in diagnosis. Though we say many of the things, but when it comes to diagnosing a case, it becomes difficult. Particularly coming to the Ayurvedic diagnosis, it is somewhat difficult compared to modern diagnosis, because modern diagnostic guidelines are very easily available. But Ayurvedic guidelines, it is not that much of, though organized, but at the general practice level, to understand them, it becomes difficult for us. And like I have put forward some of the clinical conditions. All these clinical conditions like anxiety disorders are there, depression is there, mania is there, otherwise OCD is there. And such type of cases are we can diagnose them in modern parlance. But when it comes to diagnosing an Ayurveda, what is those clinical conditions? How it can be? Whether anxiety is described in Ayurveda, mania is OCD is whether described in Ayurveda. That becomes difficult for us to come to a conclusion. And difficulty in doing Shodhana and other therapies, because particularly in Manasarogas, the first line of treatment is Shodhana treatment. Depending upon the clinical condition and the doshas involved, Shodhana therapy is first line of treatment. But at the general practice level, it becomes difficult. It is not possible at OP level to do this Shodhana therapies. Okay. In the same way, availability of medicines and also quality of medicines. Though in books, in Shastras, we may be coming across many of the names of the medicines, but when it comes to their availability to practice in general practice, it is really difficult to get those medicines. And whatever is available, the of medicines is very low, because not only the medicines related to Manasika Roga, any type of medicines, if quality is not proper, then it becomes very difficult. We lose our own confidence in our science itself. And the very important point that has to be noted is medicines have limited role, whereas in Sharirika Rogas, medicines are they have the upper hand. But when it comes to Manasika Roga, medicines have very limited role. And particularly those cases that we come in general practice, because these at general practice level, these are the Hina Sattva to Madhya Sattva level, otherwise Purva Rupas of Unmada, Manasika Rogas. Such type of cases we are coming across, and particularly for such type of cases, medicines have very limited role. Their psychological interventions are needed, And at the general practice level, it may not be that much of easy. Next slide, please. And also, specialist nursing care is needed. In severe Manasarogas, specialist nursing care is needed. And in general practice, it is not possible. And there are some legal issues. If you want to treat this mental psychiatric specialty disorders, there are some legal issues. We have to be aware of it. And as I told you, any clinical condition, particularly of this psychiatric conditions, Manasaroga, it is just if some, even for a specialist also, those the person who completed his PG in Manasaroga also may not be able to manage the Manasaroga as a single person, because it is a team of experts which is needed. It is a team effort where Yukti Vipasaya, Sattva Vajaya, and Daiva Vipasaya Chikitsas are needed. That's why as a single person, it becomes difficult. Always it is a teamwork. Right? And another problem is already using allopathy medicines. Because allopathy medicines, as I told you, compliance for this allopathy medicines is very low. And many problems will be there, but abruptly we cannot stop them. Otherwise, there will be rebound symptoms will be there. Clinical condition will be aggravated. That's why if the patient is using allopathy medicines, we have to taper them. So for that one, we should have minimum knowledge and what is the dose needed and how we can taper these allopathy medicines. So the minimum guidelines on these issues we have to be updated. Okay, next slide, please. And some of the guidelines I want to share with you is interview. Primary guidelines, first one is interview. And we have to interview both patient and relatives. And while interviewing, we have to be very, very attentive what patient is talking, and the content what patient is expressing, that is very important. Because while talking to the patient will be expressing some of the keywords, and we have to understand those keywords. Those keywords are very important, by which the underlying clinical condition can be observed. Okay, and whatever we are communicating, it should be clear and be empathic, and we have to be very sensitive while communicating to the patient, because everything we have to first judge the condition of the patient. Then only how much you can go deeper, how much you can explore the patient's underlying condition. We have to understand that one, so that it becomes very easy. And our behavior should be friendly, and it should be respectful and non-judgmental. And because non-judgmental, why I said, because we should not be predetermined. We have to understand the patient as such total. That's why we should not be predetermined. And at last, it should not end in a dependence, because if you give too much of care, that is undue care with sympathy, if you deal with such type of cases, naturally at last the patient becomes dependent on us. And whatever, for a simple things also, he consults us, and it becomes difficult. So that's why there should not be any dependence in due course of this management. We have to be very careful. And there is social stigma. We have to be very careful before expressing any diagnosis, and with whom we are sharing such type of details. We have to be very careful, because there is social stigma. And while doing interview, let patient ventilate and find the solution. For each and everything, you should not command, you should not advise, and you should not negate what patient is expressing. Let patient express. And while discussing during his discussion interview, patient at one level, he knows what is his problem, and he knows what is the solution for it. And it is our duty that we have to encourage them that much. Of course, we can guide them, that much we can do, but we should not advise. And our own experiences should not be mixed with patient's life events. And always rule out organic involvement, because many of the physical disorders also having some psychiatric symptoms will be there, particularly this endocrine disorders, otherwise brain infections, such type of cases. There will be some psychiatric features will be there. So we have to be very careful. We have to, because before diagnosing any psychiatric condition, we have to rule out organic involvement. And it is very important. The last one is risk of suicide. Many of us will be thinking that if you ask whether you are having suicidal ideations, whether you have attempted any such type of suicidal attempts are there in your life, we should not hesitate. After initial interview, and we have to end with this one, we have to be very careful, because many of these, if you don't ask many of the patients, even for the physical disorders also, if someone is suffering from incurable disease, otherwise progressive physical disease also, there is every possibility for development of depression, etc. And if we are unable to analyze the patient's condition, and it may end in suicides also. So we have to, while doing interview, we have to be very careful and think of it. Okay, next slide. Like in modern allopathy system, in general practice, there are common mental disorders at general practice setup, and severe mental disorders which are practiced at a specialty setup. Common mental disorders are like generalized anxiety disorder, PTSD, post-traumatic stress disorder, OCD, obsessive compulsive disorder, somatoform disorders, conversion disorders, mild to moderate depression, dysthymia, alcohol dependence, sleep disorders, etc., which are called as common mental disorders. At even our general practice level also, we can deal with such type of clinical conditions. Okay, unless until in depression and remaining conditions, if it is not a severe substance abuse disorder, then remaining conditions at of course another condition is PTSD, if it is not that much of severe. In the same way, OCD also, if due to the long and severe nature of the OCD, patient may develop even some depressive features will be there. If it is too much severe, and it may end in suicide also. Such type of clinical conditions, we have to be very careful. Otherwise, at the general practice level also, we can deal with such type of cases. Okay, next slide, please. But as I already told in initial stage itself, such type of whether it is PTSD, GAD, etc., they are not readily described in our Ayurvedic texts. And how we can treat them, where we can find such type of clinical conditions, and what can be the reason, whether GAD, PTSD, OCD, other mild to moderate affective disorders, whether they were not there in during the time, because they're not described, because those clinical conditions can be diagnosed either in Madhya Sattva to Hina Sattva condition, otherwise Pura Rupa Avastha, and during those times, the social setup was like that. As these cases are not that much of severe, the family support with the social support, patient was able to survive, and patient was able to cope up with such type of clinical conditions and stress arising out of those clinical conditions. But nowadays, the clinical, our social setup has changed. Drastic changes have occurred. Nuclear families are there. No one is there to support no one. That's why the conditions, even a mild conditions, are becoming very severe conditions to cope up, because the threshold to stress is very much reduced. That's why, though they are not readily available in our Ayurvedic texts, due to the changed sociological circumstances, we have to know their importance, and whatever possible help that can be possible, even at the general practice level also, it can be done. Okay, next slide, please. That's why Unmada, the central point of pathogenesis of Unmada is Alpasatvasya Mala Pradusha, Buddhir Nivasam Hrudayam Pradusha. So here the central point is Alpasattva nature. Due to Alpasattva, depending upon the doshic involvement, the severity increases. And by doing various Shodhana therapies, etc., again patient is coming to this level of Alpasattva avastha. I think I am able to communicate to you. The pathogenesis is starting at Alpasattva point, and from that Alpasattva point, remaining pathogenesis is taking place, and that condition is coming into the Unmada level of clinical conditions. And while as per the Shastra, if you are doing all the management treatment modalities, then after this increased vitiated dosha condition, patient is again coming to this Alpasattva state. And that's why to make the patient completely devoid of this mental conditions, mental distress, it is not that much of easy thing, because there Sattvavajaya Chikitsa has very great role. And Sattvavajaya Chikitsa, who has to do this Sattvavajaya Chikitsa? I think even at general practice level also, there is scope for this Sattvavajaya Chikitsa. How it is there? We'll see in coming slides. Next slide. And I'm coming across some of the tattva of our Shastras. Generally, actually, what are the Manasika doshas, what are actually Manasika rogas? Generally, we say Unmada, Apasmara, etc. are the Manasika roga, but basically, Kama, Krodha, Lobha, Moha, Irsha, Mana, Mada, Shoka, Chittudvega, Bhaya, Harshadayaha. Actually, these are the basically Manasika roga, and the causes for these Manasika rogas are Rajas, Tamas, Manasa dosha. Rajas and Tamas are the Manasa doshas. Due to this Rajas and Tamas, these Kama, Krodha, the Manorogas are getting origin. And in between this Rajas and Tamas, Niyatastu Anubandho, Rajastamasoho Parasparam, Nahi Arajaskam Tamaha Pravartate. So this Rajasar, Tamasar, Parasparam, they are Anubandha, they are interrelated to each other. And wherever there is Rajas is getting involved, there Tamas is having its own role in its pathogenesis, and vice versa. Because Rajas is a cover agent, Rajas is something from the reality, it deviates one's personality, one's thinking from the reality. And Tamas is Avarana Shakti, and this Tamas is covering this Sattva, so that Rajas can have its own negative impact and negative deeds. Okay. That's why even for the basic cause of this Manasika rogas, that is explained, Manasa Punarishtasya Labhacha Anishtasya Upajayate. Another version is Manasa Punarishtasya Alabhat Labhacha Anishtasya Upajayate. Whatever it may be there, Chakrapani Acharya there says, Ishtasya Labhat Kamaharshadayaha, Anishtasya Labhat Shokadayaha. You see, if Ishta is whatever we desire, if we are getting, then it is resulting in Kama, Harsha, etc., which are again the Manovikaras. And Anishtasya Labhat, if that which is we are not liking, if we are coming across such type of things, then it is resulting in Shokadayaha. So that's why if we are driven by this Rajas and Tamas, definitely they are going to, that is due to the Ichha and Dvesha. If you are driven by this Ichha and Dvesha, which is due to this Rajas and Tamas, naturally, definitely it is going to cause various Manasika rogas of Kama, Krodha, etc., which are the basis of this remaining pathogenesis of Manasika rogas. Okay, next. This is the Hina Sattva Lakshana. Saptamuchyate Manaha. That is the Sharirasya Tantrakam Atma Samyogat. The relation is very beautifully explained here. Here, Tantrakam means Dharakam and Preraka. So this Sattva, as in first slide I told you, it is a tripod, Tridanda. Among this Tridanda, this Sattva is the connecting. It is a Tantraka, that is Dharaka, Preraka. In between this Sharira and Atma. Tat Trividam Balabhedena Pravaram Avarancheti. Here, our Sattva Lakshana is very important. Hina Sattva Astuna Atmana Napi Parehi Sattvalam Pratishakyante Upastambhayitum. Mahasharira Hepite Swalpanam Vedananam Asaha Drishyante Sannihita Bhayashoka Lobha Moha Pashupurusha Mamsa Shonitani cha Aveksha Vishada Vaivarnya Murcha Unmada Bhaya Prapatananam Anyatamam Apnuvanti Athava Maranamiti. You see that's why I told you. In general, it is very severe Alpasattva. Due to the Alpasattva nature, very severe Manasika Rogas can occur. That's why at the general practice level, maximum we can manage those conditions arising due to the Madhya Sattva to the lower level of this Hina Sattva, lower grade of this Hina Sattva. That much we can. That's why I told you, in modern, for general practice, the moderate clinical conditions are due to this Madhya Sattva. Otherwise, the upper grade of this Hina Sattva conditions, and they can be managed even at a general practice level also. Okay, next slide. And another important clinical application of this Sattva Avastha is Sattva Dina Vikalpena Vyadhi, that is Vyadhita Rupiya. It is explained there. Even for the physical disorders also, this the state of Sattva is very important. Because if a patient is having Hina Sattva, even a mild physical condition is expressed as very severe, and there the confusion arises. Okay. And these Manarogas are expressed at 3 levels. At the Manodosha level, that is Kama, Shoka, etc. Second one is Unmada level, where Sharirika doshas, that is Vata, Pitta, Kaphas, also involved along with this Hina Sattva Avastha. And the third category is Graharogas, where pure Manasika, that is very severe Manasika Avasthas are occurring there. And in this one, the Unmada conditions arising out of, that is, which are not that much of severe, those conditions can be managed at the general practice level. And this Graharogas, it is not possible at the general practice level to manage. Okay, next slide. Next slide. Okay. This is the physiology as well as the pathology that occurs. From the Gyanendriyas, the arthas are received, Manas is there, Dhi, Dhriti, Smriti. Along with Manas, that Prajna is there, and the decisions are taken, and later Karmendriyas are, as per the inputs, they are doing Karmendriyas various arthas. Here, this mind is having very much great role in interpreting the inputs as well as expressing outside the various karma pravritti also. I am not going in depth. The same is described. Indriya Nendriya Artho hi samanaskena gruhede kalpete manasatuda gunato doshato adava jayate vishaye tataya buddhi dishayatmika vyavasya tatha vaktum kartum va buddhi purvakam. Here, another simple concept is desires, thoughts, and actions. The relation we have to understand very carefully, because these are the desires in our Sukshma Sharira, the Karana Sharira, in form of desires. They are hidden there. Those desires at the Mano level as thoughts, they are being expressed, and those same thoughts are expressed as actions. So by observing one's actions, we can understand what the underlying thoughts are there. By underlying one's thoughts, by understanding one's thoughts, we can understand underlying desires. In other words, the seeds of all these various clinical conditions, rogas, Manasarogas can be understood by observing these thoughts. The relation we have to understand. Otherwise, where is the tool to understand one's mind? It is through these actions, the thoughts can be understood. Through these thoughts, the desires. Otherwise, the basic personality of that person can be understood by observing these thoughts. Okay. Next. This is the importance of Manas in various Indian sciences. Even in Charaka Samhita, it is described Mano Manortho Buddhiratma Cheti Adhyatma Dravyaguna Sangraha Shubha Shubha Pravritti Nivrutti Hetusha. So Mano Artha, Indriyartha, Buddhi, Atma. These are the Adhyatma Dravyaguna Sangraha. And in Bhagavad Gita, one of the shloka, it is very important even for our clinical conditions also. Indriyani paranyahu indriyebhyah param manaha manasastu para buddhi yo buddhehe paratastu saha. That's why it may not be easy for us to bring changes at a buddhi level. So the first level of treatment is at the indriya level, because indriya are very easily reachable for all of us. And the next way we can concentrate, target on manas. From manas we can concentrate target the buddhi also. This is the way that we can go into the depths of one's personality. Okay. And this indriya, how indriyas can be properly managed from indulging in vishama arthas, that we can these are the some of the next slide please. And first tool is food, because whatever the mind that is prevailing, it is also having the basis of the food also, as in Chandogya Upanishad it is very beautifully described. Even in Bhagavad Gita also, food is classified as satvika, rajasika, manasika. That's why food and manas is having very much relation. Even in our clinical practice also, when a patient comes us, we have to advise the patient to take satvika type of food, by which the rajas and tamas are not going to get their nourishment, along with sensory organs, indriyas also to be properly managed. But before that one, food is the ahara is very important in our clinical practice. And that's why while taking interview, we have to be very careful which type of food. Generally in our Dashavida Pariksha, Sadhana Pariksha, etc., we don't take that much of serious all these things. But when it comes to not only for mental disorders, even for physical disorders also, this food is very important. And for to maintain a proper health, satvika type of food is always needed. That's why I am not naming what are the satvika type of food, depending upon the clinical condition, depending upon the season, depending upon one's state. It varies, but ultimately we should be able to understand. It should not be of dosha prakopaka in nature. Here dosha prakopaka means not only vata pitta kapha, but also rajas and tamas also. That's why we have to take care in food, by which indriyas can, and thereby manas and buddhi also can be properly maintained. Next slide. Another important thing that we have to understand is the concept of these dharaniya vegas. Imamsu dharayet vega anhitarthi pretya chehacha sahasanam ashasana mano vak kaya karmana. These dharaniya vegas are related to mano, vak and kaya, that is physical deeds, and by vocal deeds, by and manos, by deeds that we do with our manas. So here dharana, it doesn't mean that we have to suppress them. Otherwise, what happens if without understanding the basics of this dharaniya vega, so it is not something suppression or repression, but we have to ventilate them and we have to sublimate these thoughts. I think you are able to follow me. What I'm trying to say, if someone is getting something anger, it is not that patient has to realize that having such type of kama, krodha, etc. are not good for himself, and realizing that he has to change his habit, otherwise these negative thoughts, and he has to strive the best, whatever the best he can do. So, and gradually what happens, generally we come across tapas, etc. In Ayurveda, these dharaniya vegas are nothing but the tapas. By tapas, what happens? Due to these dharaniya vegas, when we are able to practice as tapas, the tapa generated due to this tapas, what happens? There is naturally gradual change in one's personality. Okay? Please be cautious what I'm saying. Otherwise, change of personality is not possible just by giving any medication. And it is a continuous process, and that can be possible by these dharaniya vegas. And here dharaniya vegas means patient has to understand the various negative impacts of those negative emotions, and he has to maliciously, voluntarily, he has to strive his level best to overcome them. That's why there should not be any suppression. Otherwise, later many psychiatric problems will be there, anxiety related problems will be there without understanding this. If patient tries to suppress them, okay, let all these negative thoughts be sublimated, by which personality change can occur gradually. Okay, next slide. Yes, shariram saptam vidhiyate saptam cha shariram. Because whatever the body is there, it is due to the sattva state, and whatever the once sattva state is there, it is due to the bodily elements also. That's why both the physical health as well as mental health, the relation has to be understood. And in Ayurveda, it is very beautifully described. Whatever the sadvrutta, diracharya, vrtacharya are described, it is not only just for physical health, but also for mental health also. I'm not going in depth. If this is needed, in discussion will go in depth. Okay, next slide. I already explained. Sattva pariksha is important. Even Vyadita Rupiya, that is also important. Manas is Atindriya. That's why it is Anumanagamya. That's why by observing one's thoughts, we can understand one's personality, and by so that the pathogenesis also behind that one. Okay, next slide. And you know very well, Manasapati Bhaishijam Trivargasya Anvekshanam. Tadvidya Seva, Vijnanam Atmadinam cha Sarvashah. I'm not going in depth. You know it. Okay, next slide. This is very important. Sattva Jayaha Punaha Ahitebhyo Arthebhyo Mano Nigraha. How this can be possible? Because we talk a lot on the Sattva Jaya. How, as in Dharaniya Vega, I gave you one of the hint how this can be possible, Sattva Jaya, by this Dharaniya Vega. Here, the Sadvrutta is for this Sattva Jaya only. That's why Tasmad Atmahitam Chikirshata Sarvena Sarvam Sarvada Sadvruttam Anushteyam. You see the Acharya statement here. Taddi Anutishtan Yugapat Sampadayati Arthadvayam Arogyam Indriya Vijayam Cheti. You see, this statement is very important from Charaka Samhita. Bhagavan Atreya says it is Arogyam Indriya Vijayam. Both can be possible by doing this Sadvrutta Anusthana. And that's why we don't give that much of importance for this Sadvrutta, but when it comes to even particularly of this Manasika Roga, Sadvrutta Anusthana is very important, because I have seen many cases where when the patient deviates himself from this Sadvrutta, there will be aggravation of the clinical condition. Another important vachana from Acharya Bhagavan Atreya is Ahara Achara Cheshtasu Sukharti Pretyachehacha Param Prayatna Matishte Buddhiman Hita Sevane. So these are very important, though we don't take that much of seriousness to these principles, but when it comes to clinical practice, they are very, very important in our general practice. Okay, next slide. Here, the first line of treatment for Manasarogas is Shodhana Chikitsa. I told you. That's why even at general practice also, if it is possible, if not Shodhananga, Purva, Sneha Karma, later the Pradhana Karma, Paschat Karma, we may not be able to do at a general practice level. But whatever the possible Shodhana therapy, if minimum Koshta Shodhana, if it is done, and later we can start the remaining medications, etc. That's why minimum Koshta Shodhana we have to do, because it is having very much importance. Hrudindriya shirakosha samshuddheva manadivihi manah prasadam apnoti smritin sangnyancha vindati. That's why we have to be very careful, and minimum shodhana karma before any medicine is given, started, we have to do this Shodhana karma. And the remaining principles, the Shuddhasya Achara Vibhrinshati Iksham Navanajam, etc. At general setup, it is not possible to do. Okay, these are the various principles. Next. In this one, the second shloka, that is important. If we have that patients some experience, that can be done at a general practice level also. Tarjanam, Trasanam, Danam, Harshanam, Santwanam, Bhayam, Vismayo, Vismuter, Heto, Nayanti, Prakriti, Manaha. These are the upayas, Adravya Chikitsas described. If we are having that patients as well as the expertization, clinical experience, these are the simple techniques by which the prevailing mental thought processes can be modified. Okay. Okay, next slide. Another principle is Ishtadravya Vinashatu Mano Yasyopahanate Tasya Tat Sadusha Prapti Santva Shvasehi Shamam Nayet. Like in PTSD, I told initially, like in PTSD conditions, this is the principle that we apply. Ishtadravya Vinashatu, post-traumatic stress disorder, in which patient is losing his loved ones, loved things, and thereby there will be various anxiety related, depression related symptoms will be there. In that condition, this principle has to be applied. Ishtadravya vinashatu mano yasyopahanate tasya tat sadusha prapti santvashvasaihi shamam nayet. Another simple sutra is kama shoga bhaya krodha Harsha Irsha Lobha Sambhavan Paraspara Pratidvandai Rebhre Vashamanayat. This is Pratidvanda Chikitsa. Again, if we have some minimum clinical exposure to do this one, this principle also, even at general practice level also, it can be applied. And the most important one is Nivruttamisha Madhyoyo Hitashi Prayatashuchihi Nijagantu Virunmadaihi Sattvavan Dasayujyate. So in Sadhurta also it is described. Here again it is described Nivrutta Amisha Madhyoyo Hitashi Prayatashuchi. So Amisha and Madhya. Here again Amisha and Madhya, these are the indicative of Rajasika and Tamasika food. And we have to advise patient to be avoid this Rajasika Tamasika nature food. Okay, next slide. Another condition is apasmara. In this apasmara, compared to unmada, here tikshna shodhana karmas are described, and at the general practice level, it may not be possible. But one principle that can be that we can practice at a general practice also can be done. That is shilayet taila lashanam payasa va shatavari brahmi rasam kushtarasam vacham va madhusam yutam. So in apasmara cases, the minimum shodhana karma that can be possible at a general practice level we can do. Later, these principles of this rasayana as well as the medications can be applied. Taila lashanam, shatavari payas, brahmi rasam, kushtarasam, vacha, madhusam yutta, added with madhu. This can be given, and they are very though they are described very classically many years back, they are now very we get very good results with this medication in apasmara also. Another important thing is, while in doing interview also, we have to be very careful. Acharya Vagbhata says here, Mukta mano vikarena tvamittam itham krutavaniti na bruyat vishayairishtahi krishtam cheto asya brumhayet. So the various negative things that occurred during any mental illness condition that should not be brought back into the memory of the otherwise mental plane of the patient. And if at all, if it is needed, it should be, we have to be very careful, because it may cause something negative impact on one's mental state. Okay, next slide. That's what I told. Muktam mano vikarena tvamitham krutavaniti na bruyat vishayairishtahi krishtam cheto asya brumhayet. Next slide. This is related to Agantujonmada. I'm not going in detail and depth also. This is how we can differentiate from Nijonmada and Agantujonmada. It is given there. Here the treatment also bhutam jayad ahimsechum jabahoma balivrataihi tapashila samadhana dana jnana dayadivihi. Of course, at general practice level it is not possible. Even specialist practice level also, single person, it is not possible. Okay, next. Next slide. Already explained it. Next slide. Next slide. Yes. Here it is important, the principles to be remembered. First principle is remove tamo avarana. And of course, by the shodhana karma, the tamo avarana can be removed. That's why whatever the extent possible, the shodhana karma that we can do, that has to be done. And control rajo pravartana, that is by dharaniya vega principles, what I said with that one, rajo pravartana has to be controlled. And maintain sattva sthiti, for which the individual as well as the family members, otherwise colleagues, with their help, this sattva avastha can be managed with food and other sadvrutta acharana. And ojo vardhaka akasha bahulya satvika ahara vihara aushadas are another condition is I can add now prana. That's why these are the positive entities in our body. One is ojas, another is akasha, another one is sattva, another one is prana. That's why by increasing ojas, otherwise by increasing sattva, by increasing akasha bhuta, otherwise by increasing prana, no one is getting any disease. But they are always positive things. But any decrease in this ojas, otherwise akasha, sattva, otherwise prana, they result in various physical as well as mental disorders also. So these are the common principles that we have to understand. By this ahara vihara aushada, our aim should be ojo vardhana, akasha bahulyata, satvika vardhana, sattva vardhana, as well as prana vardhana. Okay, next slide. So for our general practice, I am listing here some of the aushadas. Like in general practice also, we can avail them. Medhya rasayanas, they are having very good effect in various Manasarogas like Manduka Parni, Yashti Madhu. Here Anupana, as Acharya told, we have to follow that one. Okay, Guduchi Sankapushpi. And some of the Ekamulika Prayogas, single drugs, Vacha, Kushta, Kushmanda, Brahmi, Jatamansi, Gokshura, Sarpagandha, Ashwagandha, Rasona, Shatavari, Vishnukanta, etc. These are the various single drugs that can be used in various conditions. And these are the some of the Dhupana Yogas, Haridra, Daru Haridra, Hingu, Richa, Shirisha Bija, etc. By this these Dhupana Yogas, as well as Dhupana also can be done, and they are having very good results. Okay, next slide. Some of the available classical yogas: Kalyana Kashaya, Drakshadi Kashaya, Brahmi Drakshadi Kashaya. As Kashayas, they are having they can be used in our general practice for Manasika Rogas. Kalyana Ghrita, Mahakalyana Ghrita, Brahmi Ghrita, Panchagavya Ghrita, Tiktaka Ghrita, Mahatikta Ghrita, etc. Also having very good results. As I told you, the quality, though medicines, some of the medicines may be available, but the quality of these medicines, because nowadays Ghrita is not at all a Ghrita. That's why if you go through the indications of Kalyana Ghrita, it is like ambrosia. There is no medicine, unparalleled medicine that is available on this earth. But if you use this Kalyanakar, Mahakalyana Ghrita, we are unable to get such type of wonderful results, because the Ghrita is the base of this Ghrita itself is not Ghrita, because they are not from the cow. Even it is a cow, the cow itself is not of Indian cow. The milk that we are getting out of those cows itself is not actually the Ghrita that is needed for our medicines. That's why, if it is possible, if we can prepare some of the medicines for our general practice, then naturally we will be having very good results. Okay, some of the Vilvadi Gulika, Vilvadi Gulika, not only for internally, even for Anjana purpose also we can use this one. And Manasamitra Vatakam, these are the some of the drugs I wanted to present before you. Next slide. Yes, for some of the clinical conditions, I have given some of the drugs that can be used in generalized anxiety disorders: Shankapushpi, Gokshura, Ashwagandha, and Drakshaya, Sri Khandasava. For external application, Tungadrumadi Taila, they are having good results. In OCD, Brahmi, Vacha, Shankapushpi, Kushta, and Tiktaka, Mahakalyana Ghrita, they are having Manasmitra Vadaka, Tungadrumadi Tailam for external application on the head. And cognitive behavior therapy, if you know, that also can be applied in OCD. And in somatoform disorders, Manduka Parni, Jatamamsi, Drakshadi Kashaya, Ashwagandha, and Dhanvantaram Tailam, Narayana Tailam, they are having good results in somatoform disorders. And of course, conversion disorder, generally in general practice, sometimes we may, in remote areas, we may get such type of case. In that case, Tiktaka Ghrita, Vacha, Jatamamsi, Kalyana Ghrita in later stages, Saraswata Arishta, Tungadrumadi Taila are having good results. In PTSD, Kalyanaka Kashaya, Mahakalyana Ghrita in later stage, and Sarpagandha, Gokshura, Shankapushpi, Dhanvantaram Kadambu for external application, it is having good results. And in phobia conditions, Vacha, Jata, Mamsi, for Dhupana and Saraswata Arishta, along with the drugs described for PTSD can be applied in phobia also. In depression, Vacha, Kushta, Shankapushpi, Jata, Mamsi, and Panchakavya Ghrita, Ayaskriti, okay, Hingo, Daru Haridra, Jatamamsi, Vacha for Dhupana Karma. These drugs, mix of these drugs can be used for Anjana purpose also. We can use Vilvadi Gulika, etc. And Saraswata Arishta, Manasmita Vatakam is also having good results. And in sleep disorders, if there is increased sleep, then Anjana and Dhupana yogas can be used. Tiktaka Kashaya can be used. If there is in sleep deprivation, decreases sleep, Mahakalyana Grita, Yashtimadu, Gokshura, Jatamamsi, Shankapushpi, and Srikhandasava, Draksharishta, they are having good results in decreased sleep, along with Abhyanga, etc. general principles. Sexual disorders, particularly of increased sexual drive, that even in some of the personality disorders and mania, it can be observed in that conditions. Tiktaka Kashaya, Aragvada Kashaya, Kushta, Vacha, Tripala Gugulu is having good results in that increased sexual drive. Okay, next slide. And apart from these drugs, yoga is having very good results. Minimum patient should be guided on minimum asanas and Surya Namaskara, depending upon the condition, whether it is brisk or slow, that we have to advise the patient. Okay, if kapha predominance, otherwise tamo predominance is there, then brisk type of asana and Surya Namaskara are to be advised. If it is there is a rajasika, otherwise some vatika, paitika nature are there, then slow type of asana Surya Namaskara to be advised. And pranayama, if not all pranayamas, minimum Nadi Shuddhi pranayama, Anuloma Viloma pranayama, and Brahmari, they can be practiced by all, but of course there should be minimum guidance. And Kapalabhati, though advisable, but it is without proper training and guidance, it is not advisable. And when it comes to dhyana, nowadays dhyana is it is having a fashion, but if it is not properly guided, dhyana may result in some of the negative effects, particularly if patient is suffering from anxiety disorders or depressive disorder, in other ways in his initial stages of schizophrenia. By dhyana, more than the good, harm will be there. That's why, depending by understanding the mental condition of the patient, we have to advise the patient. And better for initial stages, it should be a guided one. Okay. Next slide. Here in conclusion, we have come to the conclusion. It is 9:15. Okay. We need not be an expert, but we can help the sufferer with proper diagnosis and guidance. That's why minimum we should have the minimum diagnostic skills, so that the patient can be referred to the expert where the proper management can be done. And knowledge gaining is a continuous process. That's why if you are not having MD degree, otherwise you are having only general practice, of course, by uh, applying our interest, by attending the various programs, we can increase our knowledge. And we should always strive our level best to gain the new knowledge, and should try our level best to have clinical experience also from the guides. And for this one, understanding the basic principles is very important. That's why not just one clinical condition, one drug, it should not be like that, because until we understand the basic principles, the proper management skills, we won't get it. And serve without expectation. And if you are having that seva, that love towards the beings, that the love itself, actually, whatever the drugs that we are having, whatever the principles that we are having, the driving principles behind all this one is, it is a without expectation. If you are able to love, unconditional love, it is the first medicine that is needed, because all we are living, all living beings are existing. The cause for this existence is unconditional love of that great Almighty. And if we could inculcate such type of good bhavas, naturally our presence itself will influence the sufferer and give them some sukha and ananda. That's why be part of the serving men. With these words, let me conclude. If any further discussion is needed, we'll have. Okay, thank you. Next slide. Thank you very much. I hope you could follow something.
Okay, sir. So with that, we will go ahead and take some time for questions.
In my initial presentation, I used some of the Malayalam. If anyone is had difficulty in understanding those things, you can ask me, so that explain some of the clinical conditions. Otherwise, you can share your experiences also. We can discuss here. If you are doing clinical practice, even in our own life, we are having such type of experiences of our own life, otherwise lives of our family members, friends, we come across.
Sir, there is a question.
Hmm.
Sir, can you please tell the role of counseling?
Yeah. Counseling, as I told you, nowadays we are having this word of counseling. Counseling is having many meanings. If someone is suffering, if we are able to support them mentally with our words, with our actions, that itself is a type of counseling. But there are various stages, because if some death occurred with some simple ashwasana, it is possible to control, to give comfort to the patient. But if it is having too much of impact on one's psychological level, and there we need, it is not by simple words, it may not be possible. And that's why counseling, here counseling means, as I told you, if patient is having insight intact, then only counseling can be possible. There are some conditions where counseling cannot do anything. Like in if you take Ayurveda also, very severe condition of Vatkonmada, Paitikonmada, Kaphajonmada, and Grahajonmadas, counseling is not going to work, because at the same time, if someone is having very hina sattva lakshana, those persons are not going to get any result out of this counseling. If patient's sattva avastha is of madhyama sattva avastha, otherwise clinical condition is not that much of severe, in those conditions counseling can be done. And if of course there are various steps, and we have to follow those steps. Nowadays many courses are there, but clinical exposure is needed. We have to work and understand the clinical conditions, then only we can do it. But basic counseling means, the basic step of counseling is, as I told you, love the others, everyone. And there should be drive from our heart to support them, to help them. If that is there, naturally whatever we talk, whatever we do, that is going to help them. Okay. Next, I think.
Sir, one more question.
Yeah.
How can we make out the fact that depressed patient will go in for suicidal tendencies?
Pardon? Please repeat once again.
How can we make out the fact that depressed patients will go in for suicidal tendencies?
So, because if someone is having suicidal tendency, one, by asking his history, clinical examination, we can understand. First thing is whether he did any such type of suicidal attempts before. That is first thing. Second thing is whether patient is having any ideas of suicide. And these ideas of suicide will be expressed to his friends, otherwise very nearby fellows, otherwise relatives, family members. Otherwise, he himself mutters, what is the use of living this life? It is better to end. Such type of thoughts will be there. And mostly, those persons who are having these suicidal ideations, generally they express. But in society, generally what we think, barking dog never bites. That's why we take them very lightly. And in many of these cases, we have seen that if we are not giving proper attention and importance to those expressions, at one stage patient commits and ends his life. That's why it is generally they express. Never happened that someone who is doing suicide without expressing that idea, someone committed suicide. It never happens. Only in accidents it happens. And in many of the accidents also, if you properly examine, there we find some clues. Such tendencies were there. So it is very expressive. Suicidal ideation, suicidal attempts, they are very much expressed. And we have to be careful. We have to listen to them. And if we could able to stop those thoughts for a minimum of some 1 or 2 minutes, we can save the patient. They're expressed. They're very, very, very openly expressed. We have to give some attention, that's all.
Okay, sir. Another question. A person suffered from depression, loses his or her confidence, and has phobia. How can we develop confidence again?
Both are. Phobia is something different. Generally, there is a different clinical condition. First condition is what you asked, depression. Can you repeat, Bhagya?
Yes, sir. Yes, sir. First condition is depression. A person suffered from depression, loses his or her confidence.
It is a losing confidence is also due to depressive thoughts. It will be there. And by giving proper medication and proper mental support, he can come out of it. Because if depression is due to the dosha avastha, sharirika avastha, and if properly the doshas are managed and proper drugs or medicines are given, he can come out of it, because those thoughts are being influenced by that pathological conditions. Okay, in depression, we can make the patient come out of it. Again, it is good question you made me to tell another thing. Those patients suffering from depression, though they are having these suicidal ideations, but in depressive patients, they are also having lethargy. And that feeling of energy, loss of energy is that much that patient, though he may be having these suicidal ideations, cannot attempt suicides because patient is unable to execute them. That's why when you do treatment for the depression, when patient is gradually improving and patient gets some feeling of physical energy, but still he's having those depressive thoughts and ideas of suicides. And when patient feels something improvement due to this treatment, and that's why depressive patients in the second stage, that is after getting some improvement due to the medication and the treatment, commit suicides. That's why many of the patients, those discharged patients from the hospitals and under the treatment in the hospitals, those patients, depressive patients, may commit and end their life. That's why there we have to be very careful. And the loss that occurred due to the depression, that can be very easily gained. But phobia is another condition. Phobia means it needs some another techniques. We have to expose the person gradually to those things to which he's having phobia, and gradually other way. There are many methods are there, flooding, etc. Many methods are there. Gradually we can expose the person gradually to that phobic thing, and naturally he can be out of this phobia. During that condition we can give some support. Okay. And a depressive patient can gain confidence in later time, but during improvement we have to be careful.
Okay, sir. Next question. Sir, could you please explain how to manage postpartum blues and postpartum depression in general practice?
It is one of the, to be very frank, one of the grave condition. Many times, though in modern we say it is postpartum blues, otherwise depression. Many in some of the conditions it is a graha avesha avastha is also there, and we have to differentiate in between whether it is just doshika avastha, otherwise graha avesha avastha. If graha avesha avastha is there, is needed. After experience I am saying, and for that one, and if it is such a grahavesha is not there, then patient will improve naturally when she comes out of this stress due to the various metabolic changes, okay, hormonal changes, and naturally after some 2 weeks patient can develop into the normal stage. Otherwise there is possibility for the suicide for the patient as well as the child also. First thing is we have to be very careful. 24 hours care has to be taken. We have to be vigilant. And whenever patient says something negative, we should not negate it more than, but what we have to do, we have to support them. Don't stigmatize them. Don't never say that you are talking something nonsense, but give support. And the second thing is in medication, Anjana and Dhupana, they are having very good result. Anjana with Shirisha Bija, one yoga is there. Nasya also can be done. Also, Dhupana yogas are there in this Grahonmada and Unmada there. Those Dhupana yogas, if nothing is available, Haridra, Daru, Haridra, Jatamamsi, readily they are not available even with Vadi Gulika. The Anjana Nasya can be done. Dhupana also can be done. And whatever the physical health, to maintain physical health, what can be done, that is also good for in this condition also. Jiraka Guda, etc. They are also having good results.
Okay, sir. Next question. Modern people believe that depressed patients have more tendency for suicide during treatment. Can you substantiate?
Yeah. I told na. During depression, when patient is improving, is having underlying thoughts of the suicide, but in severe depression, patient is unable to execute those suicidal thoughts because patient is having he feels that fatigue. That is fatigue for the patient. So when patient is improving from the depression, patient feels something energetic and he commits suicide. It is there. It is there. And when it comes to Ayurveda, we can understand it very well. That is, if we are able to differentiate from this Kapajonmada and other types of Grahonmadas, there in initial stage itself, we can understand, we can differentiate them. Okay? And it is not the case to be dealt in a general practice also.
Okay, sir. Questions ഒക്കെ കഴിഞ്ഞെന്ന് തോന്നുന്നു. പിന്നെ question ഒന്നും വന്നിട്ടില്ല.
ഇത് വളരെ സ്കോപ്പുള്ള ഒരു ഏരിയ ആണ്. അതുകൊണ്ട് ആയുർവേദ കുട്ടികളും ഈ ഏരിയയിൽ കുറേ വരയ്ക്കാൻ സാധിക്കും. ഇനി വരാൻ പോകുന്ന കാലമൊക്കെ മാനസിക രോഗങ്ങളുടെ പ്രിവലൻസ് ആണ്. There is every possibility, whether it is due to the lifestyle disorder, non-communicable diseases, otherwise infectious diseases and communicable diseases. Ultimately, it is going to have toll on our mental health. So namku even UG levelum PG levelum we have to work hard to understand the basics of this Manasarogas, particularly in a general practice. There is every scope. For Ayurveda, the scope is increasing gradually, and for this Manasarogas, there is every scope, increased scope is there, and there our responsibility also. That's why we have to strive our level best to understand and share our thoughts, knowledge, help the needy. Okay.
ഓക്കെ സർ, എനിക്ക് തോന്നുന്നു ക്വസ്റ്റ്യൻസ് ഒക്കെ കഴിഞ്ഞെന്ന് തോന്നുന്നു. നമുക്ക് കൺക്ലൂഡ് ചെയ്യാം സർ.
Okay.
ഓക്കെ സാറിന് ഇനി എന്തെങ്കിലും പറയാനുണ്ടോ അവസാനമായിട്ട്?
ഇത്രയേ ഉള്ളൂ. എന്തായാലും എൻ്റെ സ്റ്റുഡൻസ് കൂടി ഇതിൽ ഇൻവോൾവ് ആവുന്നത് വളരെ സന്തോഷമാണ്. അങ്ങനെ ആയുർവേദം ഇതുപോലെ തന്നെ വ്യാപനമാവട്ടെ.
Okay, sir. Thus we come up to the end of the session. Before winding up, let me thank our eminent chief guest, Professor Dr. G. Nagabhushanam, sir, Principal of Shantigiri Ayurveda Medical College, for accepting our invitation without refusal. Sir, the presentation, sir, ഒരു question വന്നിട്ടുണ്ട്. Sir, medication to stop overthinking.
Medication. Okay. Medication in overthinking. In this overthinking, medication is having its role, but first line of treatment is you have to understand why that overthinking is there, and try to understand that one. Next one, to stop that one, we have Shweta Shanka Pushpi Churna. It is very good one, along with Kalyanaka Grita and some Tungadrumadi Taila, otherwise Ksheerabal also. As Thalam, we can have some Draksharishta. It is having, because due to this overthinking, if Rasakshay is there, Vokshay is there, is having good reason, as well as I told, Mahakalyanagata also in later stages, if Agni is properly is there, that can be also good. Okay.
Okay, sir.
എന്തായാലും ഇതുപോലെ ഒരു അവസരം തന്നതിന് ഐ എം വെരി താങ്ക്ഫുൾ ടു ഡോക്ടർ അശ്വതി, ഡോക്ടർ ഭാഗ്യ, my student Sabin, Nitin, and other team behind this event. Thank you very much. Thank you.
Okay, sir. And I take this opportunity to extend my sincere gratitude to you on behalf of GDH VARKALA and AMAI ATTINGAL Area Committee. And next, I would like to extend my sincere gratitude to each and every person for attending this webinar. Thank you for being with us till the end. And I hope that the program like this would definitely come up again, bringing more knowledge and opportunity to the present era. I once again thank you. Thank you, sir. Thank you very much. Thank you. Okay, sir.
Thank you. Thank you very much. Thank you all.